So, Omondi Ochuka, how are you doing?
I'm great. Great.
I don't know how long I have known you for. I think maybe how long?
Since Isiazangu.
Isiazangu?
Yes.
Isiazangu was 20 what? I'm very bad with memory.
2013. 2013 to 2015. Yeah, about.
2013 to 2015. Okay.
Yeah.
So when I first knew you, I just thought that you're a normal person.
Yeah. Who is a normal person?
I don't know, man.
Yeah.
Okay, the word is healthy.
Yeah, but the arbitrary part of it.
Yeah, the word is healthy or health in quotes.
Yes.
I don't think are there people that are 100% healthy?
I doubt so. I think people are just people.
Yeah.
And I remember when one time you visited, and I told you one of the hardest things that many medical practitioners are dealing with currently is the idea that one person can never be. It's not a black and white.
Yeah.
Yes. When I visited, when my grandmother was still in good memory.
Yeah.
I remember the very first time when I was asking her, so now how have you been?
Yeah.
And she told me the way I am.
The way I am.
Yes. That's very grey.
Very great.
It leaves you thinking, so how is she?
Yeah, but anyway, I came to realize that you had been diagnosed with cancer.
Yes.
Is it cancer of the brain or cancer? Which cancer?
It was liver cancer.
Liver cancer.
Yes.
Yeah, and I think it is around that time that I realized that cancer comes with a lot of pain.
It does.
Yeah, so I have known pain for about, I think, 15 years.
It's a long stretch, almost 2 decades.
Yeah, because I remember I started having serious pains when Kibaki, was it Kibaki?
Must have been, or towards the end of Kibaki's administration, I think.
Yeah.
Yeah.
But I think I have had pain for some time. I think the question, is it muscles? Is it limbs? Is it what? But it came to be known later on. But I want to start with your story of pain. I think everybody knows about cancer.
Yes.
But I don't think people know the nitty-gritties.
Yes.
Especially when people say that you're in pain because of cancer. What sort of pain is it?
You see, pain is funny.
Yeah.
Remember when we were talking about it last time?
Yeah.
Pain is funny because there are several types of pains or categories of understandings of pain. Pains are like scars.
Yeah.
When somebody says, I am a scarred person, you could be wondering, is it a physical scar of, this is a scar that I got when I was very young. We had one cow that was very rogue. And I was very young, I was just friendly with this guy,
Yeah.
And I got that scar. This is a physical scar, but there is also another scarring, emotional scars.
Yeah.
And then there is probably something that is more metaphysical, like your own existence. So when you get diagnosed, usually cancer comes with a lot of physical pain because your cells have gone rogue. The body as you knew it is undergoing several changes.
Yeah.
So this affects how your body works, the processes within your body.
Yeah.
How you digestion, how you think, cognitive, what you can be able to do physically.
Yeah.
And then along the way you realize there's also emotional or psychological part of it. How your emotional mappworks are made.
Yeah.
What do you think about your diagnosis? What do you think about the treatment?
Yeah.
What do you think about your social fabrics?
That is the meta part of it.
The meta comes later.
Yeah.
And the meta usually comes, from my experience, it comes from a bit of long-term survivors. When you survive for a longer period of time.
Survived the pain or survived
the cancer.
The cancer.
Yes. And not just long-term, it's also mostly for terminal cases.
Yeah.
You realize that when cancer happens to you, you're diagnosed with cancer, it turns you inside out.
Yeah.
It it like puts a mirror before you, and you begin to question your whole existence. What is my meaning? What is my purpose here?
Yeah.
What is the meaning of pain? Why should we have pain? Because you realize it's not just a disease anymore. It's something that makes you put things in order, do emotional homework.
Yeah.
And when you're doing that, you're not just doing the emotional bit of it or the physical needs of that disease. You are reviewing your life, how you link up with people. And that's why you see most people get more spiritual.
Yeah.
Towards, after you've survived, it's either you're going to be pushed toward a faith crisis where you begin to question, really, God, why did you have to put me through this?
Yeah.
Or it could make you really strong in your faith because you believe this is now the thing that brings you meaning.
Yeah.
Or it could make you indifferent.
Yes.
When you're indifferent, you're in the swinging area. You're always wondering. Sometimes you're very strong in your faith, and other days you're so low of it.
Yeah.
So you're always trying to find yourself a balance in between.
Okay.
And that is not very easy. That is what brings in the metaphysics of it.
Yeah.
The beyond the physical realm of who you are.
Yeah.
Yeah. And that pain, it's very hard to cure.
Yeah. So I'm going to get back to your pain.
Yeah.
And how it manifests itself.
Yeah.
But first of all, I want to talk about my pain and how it manifests.
Yeah.
So I think my pain goes back to, I remember it very well in high school. How I remember it is that, in high school, you can be given an issue, whether it's fitting, whether it's not fitting.
Yeah, just go with it.
You will grow into it.
Yes.
But then I remember my sister bought me a pair of shoes. And it wasn't fitting at the time in Kisumu. And then when I got to school, I realized, oh shit, I can't wear these shoes.
Yeah.
Because the pain was too much. I waited for it to subside. I waited for it to sort of go away.
Yeah.
And then I realized, so the pain was coming from. So if this is your foot, the pain was here.
At the edge.
Yes. Yes.
Yeah.
And then it was also here, and then it was searing at the heels. Okay. So it was very bad pain. So I stopped wearing them. And I was going about my business in school in slippers. And then, of course, you wouldn't be allowed.
You didn't have trouble with the teachers.
So I had to limp back to Kisumu and tell my sister that these shoes are not working. And I remember she got me very good shoes after that. They were perfectly fitting. The soles were made of rubber. And I sort of saw a difference immediately. When she gave me shoes that the sole was made of rubber. It was very spongy and very springy. And I loved those shoes for a long, long time. But even though I loved those shoes, there was I don't know how they make those shoes, that the one that is coming up here, it sort of at the center. Yes, there is this thing.
Yes.
There is this thing.
Yes.
They sort of, there is something here. So that when you do that, that place. But that place was still not so good. So it became apparent that my heel was not very good. Probably the shape of my feet, I don't know what was going on. You see. So when I came to Nairobi, I started feeling a lot of pain on my foot. And it only got worse. I did not seek any medical attention
for it, yeah.
Because, there was no luxury.
Yeah.
There were other pressing issues. Yeah. There were other pressing issues, such as how to get food, how to get fare, how to get school fees for your. So basically, I was. As you know, health is a very expensive affair in this country. So I think 10 years ago, just before Uhuru became president, in 2013,
that is the first election.
During Isia zangu, those days, I started feeling like there are types of shoes that I didn't want to wear, especially shoes with very hard soles. So if I wore them, I would be having pain on my heels. You see, and it great after by 2016, it became a problem. So I was mostly in pain most of the time, and walking for long or short distances, whatever it is, I would have burning sensation under my feet.
Yeah.
You know, and then in 2018, it became worse.
Like it flared up completely.
Yeah. So I would later learn is that I was no longer, because there is a heel strike.
Yeah.
So you heel strike, you heel strike, and then lift with the ball of your feet.
Yeah.
So when I realized that I couldn't heel strike, I started ball striking. You see.
But that creates another problem.
That creates another problem. So I was compensating instead of now, getting
the even pressure.
Yeah.
Transferred it to another place.
Yeah. So I transferred it to the ball of my feet.
Okay.
And I think I did that unconsciously for about a year.
Yeah.
And then I developed a big problem. I destroyed the nerves on the ball of my feet.
Yeah.
And then when that happened, there was pain all over my foot. So there is no heel strike, there is no ball strike. You have to put both of them down.
Yeah.
And so that was really painful. And so that is the journey of my pain. Even right now, it's very painful. Like it flared like a week ago.
Yeah.
And it is so painful. So I want to go back to your pain before we go to to how to manage it. How does your pain manifest? Mine is basically my feet is paining, and sometimes it swells.
Yeah.
Sometimes it just doesn't want to exist.
Yeah.
My feet just doesn't want to exist.
Yeah.
And there are other psychological,
dimensions to it.
Yeah, dimensions to it. So how does you well, we didn't talk about it properly, but you're diagnosed with cancer. When were you diagnosed with cancer?
This is 2011.
2011. So 11 years ago.
11 years ago.
Yeah.
Yeah.
So when you are diagnosed with liver cancer, how does the pain start?
Well, the pain is, for my case, it was a bit funny.
Yeah.
Because how I was diagnosed was it's a split of a second, if I would say that. Because one moment you could be in class, you're not sick, you're in good health, complete good health according to how you feel, according to how you know your body. And then the next minute you wake up in the hospital and you're wondering, so where is this?
You mean you collapsed?
Yes, I did. And I don't remember my journey to the hospital. All I remember is I'm waking up and I'm finding myself in a new environment. I can't recall the in-between. And so I'm in pain.
Yeah.
When you're in pain, for example, when you used to be young, they call it, the Luos call it chonyotiel.
Yeah.
It is very common. You knock your toe, it hurts like hell.
Yeah.
Yeah, that is the pain I was feeling. It's physical, you know it.
Yeah.
And it's also localized. When the doctor was asking me, so where are you feeling pain? I was feeling so much pain at the back, at the lower spine, and on my upper right abdomen. It was like it was burning.
The ribs?
Yeah, it was burning.
Yeah.
In between, it's like the soft, intangible pain. You can't touch it, but you can feel it.
Yeah.
And I was trying to explain to Dr. Malkid, and I was like, can you be more specific? And
he's telling you, can you be more specific?
Can you be more specific? Because I couldn't touch it, but I could feel it.
Yeah.
So I asked one of the nurses, I told her, you always have your monthly period.
Yeah.
That means you call it cramps.
Yes.
Women call it cramps.
Yeah.
So you can imagine if I'm having a cramp and I'm a man. That's the kind of pain I'm feeling.
Yeah.
Then she called the doctor aside, and I kind of know what the pain this guy is feeling.
Interesting.
Yeah.
I kind of know the pain that this guy is
feeling.
Yeah.
It's like a railroad. Somebody's poking the soft tissues inside you with some sharp and blunt and rusty needle.
Yeah.
Yeah. It pokes and leaves. It's like a torturing pain.
You mean cramping is that extreme?
Cramping can be that bad, especially for women who are going through PCOS or endometriosis. It can be bad.
Yeah.
Have you seen them rolling in the floor? Yeah, I have a cousin who she has very bad cramps.
Yeah, she rolls on the floor.
On the floor.
Every month.
Every month. And they have to take an injection for it.
Wow, that's interesting.
Yes. So that's how it was feeling for me. So they had to do a variety of tests to know, was it a problem with my nerve or like the central nervous system or with the bones, orthopedics, or was my liver having a lesion? Because this is where the liver is located, the upper right abdomen. And so we realized that actually the liver was having some lesion. It's like, if you've seen it on a scan, it's kind of, the liver is very smooth. You've seen a liver, you eat liver, yes.
Yeah, it's very smooth, yes.
It's very smooth and the texture is very good. So when it's diseased, it's kind of like, it's wrinkled and it's having blisters.
The blisters like the one you have on your tongue when you take steroid medication.
Yeah, medication. So it's having blisters. So that is one of the reasons why it's manifesting that kind of pain, because the tumors have started to affect the functionality and the nature, the texture of that liver. It's no longer in its good form. Yes, and so the pain also radiates. I'm very sure, like your case, the pain was at some point it was at the balls of your feet.
Yes,
and then later on, when you're trying to compensate for that pain, it moves to another point. I'm very sure this is one thing you did mention, but when your feet is having some pain, you can feel it in your head or your hand.
Yes.
Yeah, that is the same thing I was feeling. So as much as the pain was in my right abdomen, I could feel it radiate to another place.
Yeah.
Like my whole stomach, like my whole feet. And I think that is more psychological.
So mine basically, because it is happening here.
Yeah.
So this entire peripheries.
Yes.
All these peripheries are sort of just painful.
Yes.
And there's nothing you can do about it. And that is the difficult thing about pain. You talked about how it affects your mood, how it affects your emotion. You talked about
metaphysics.
the metaphysics of pain.
Yes.
What is that? I really maybe I'm suffering from it, but I really don't know. If you explain what it is, then
I think it's just a word I created after having to re-examine my life. But I think metaphysical pain is also what would be called existential pain. Because pain is very uncomfortable.
Yeah. I
think we're always taught to deal with joy.
Yeah.
And it's always very funny. There's a time I was having the same discussion with my doctor, and I was telling, why do you think there is no chronic joy or chronic happiness, but there is chronic pain?
Yeah.
Why is this? Why does pain has this loop, this repeating loop of chronicity? Like it keeps on recurring.
Yeah. That
it could go in as a tulia kidogo, then comes back later, even in a worse form. Yeah. Why is it so? And you realize the discomfort with pain. And the one thing with pain, as with most tragic situations, it kind of puts a mirror before you. When somebody has put a mirror before you, you begin to ask yourself, who am I?
Yeah.
What am I? What am I doing on this earth, suffering like this?
Yeah.
And I think human beings are usually obsessed with meaning or purpose or what it means to be here or a certain experience. Why should we go through that experience?
Yeah.
So when you're going through pain, it's a discomfort. One, it pushes you out of your element, out of the you that you've been known to. You've known yourself as a person who could be athletic, who could be joyful.
I used to play football. In fact, I played football until we used to play football with George Melania. We were playing it with Dames. We were playing it with my brother Otis and a couple of other guys on Gong Road.
Yeah.
You see that place that has now been
next to Impala.
Yeah.
Yes.
So we used to play. I remember my last football match there. It was very intense. And I think that is the last time that I ever played football.
Yes.
And then because I couldn't play football anymore, I went to riding a bicycle.
Yeah.
And I remember the last time I left.
Yeah.
We were with David Aswani. We went to this place next to the UN. What is that place? That forest. Karura Forest.
Yes.
And I had bought this biking shoes. And they were very heavy and it's made of metal. The sole is made of metal.
Yes.
Because it clips.
Yeah.
On those
bike pedals.
Yeah, on clips on the bike pedals. And I remember that we had to ride, and then after riding we had to walk.
Yeah.
And then go back and we had to walk carrying our bikes.
Yeah. So you're tired as hell and you're still walking.
It's not the tiredness.
Yeah.
It is the sharp pain I felt, and I feel like I significantly injured that nerve.
On that day,
the muscle on that day. So what I'm suffering from is called plantar fasciitis. I don't even know if that's what I'm suffering from, and that's a very good discussion that we should also be able to have. It goes back to the kind of health professionals that we have in Kenya, or how basically they attend to patients.
Yeah.
So there is a muscle that comes. There is a bone there, plantar, and the fascia. The fascia is now that muscle, the muscle that connects the heel and the rest of the foot all the way to the fingers.
Yeah.
So according to my health, what I've gotten from the doctors is that I'm having the plantar fasciitis, the degeneration of that muscle, and so the question that I've always asked myself is, why can't it be treated?
Yeah,
you see, and I feel like that is the question. So that is the pain that I've always had.
Yeah.
And I think that the funny thing about pain is there is no closure.
There isn't.
The other day, one of my friends told me something that really hurt me.
Yeah. Why did it hurt you?
It really hurt me. Exactly what he said. So he had suffered what is it called? Is it a fracture? The smaller version of a
ligament tear or what?
No. It was just a knock, so to speak. He was playing football and then he got a knock. And he wasn't walking.
You had to be carried. Yeah.
So I went to visit him, and then I joked with him.
Yeah.
That you have always saying them a PWD.
Well, welcome to the club.
Yeah. And he returned the favor in a very happy way. He was in pain.
Your pain has that capability.
So he said, but mine is going to be okay in the next few weeks. Yours is permanent.
Yours is permanent.
When he said the word permanent, it really hit me like a ton of bricks.
Yeah.
You see, because I have always had hope.
Yeah.
That this thing, it's going to be fixed. I'm going to come back to I'm going to come back to your pain.
Yeah.
But then it's sometimes I feel like I was telling that I went to hospital the other day. I didn't go to the hospital because of my feet. But I like talking to people. And so we were just having a conversation with the doctor. And I asked him that I feel like nobody has been serious about my problem. No doctor has, because I was telling you off camera the other day that I am a tech enthusiast.
Yeah.
And if something presents itself in terms of a problem, technology-wise. I'll go into an overdrive.
Dive deep into it.
Yes,
Yeah.
I'll really dive into it and read even for the better part of the night, trying to know exactly what is going on with this problem. I don't see that with Kenyan doctors. You see,
The lack of creativity.
the lack
textbook
of the
modules is treatment.
the idea of just making a long line and being seen for 5 minutes or 10 minutes and then dismissed by
No inquiry.
just being dismissed by a bag of medicine.
And prescription.
Yeah.
Yes.
So that's why I was telling you that perhaps I don't know how have doctors. What is your experience with doctors? Because for me, I would say it's just terrible, really, the way I've been treated by doctors. Because I feel like my problem borders on nerves. I feel like I have a problem with bones. I feel like I have a problem with muscles and how strong they are. I feel like somebody has to look at this thing in a 360 degrees kind of way.
Right.
And so I was telling this doctor that I need a panel.
Yeah.
What did you call it?
It's just basically a panel.
There is a word you used.
What did I use last time?
I think you used another word.
I'll remember.
Yeah. So what is your experience with Kenyan doctors? I know you've been to Kenya. I know you've been to India. I don't know whether you've been to the States.
Yes.
Yeah. So basically 3 continents.
Yeah. I feel like, first of all, I would probably respond to one of the things you said.
Yeah.
You remember the last football match.
Yeah.
And it got me thinking you probably have been experiencing metaphysical pain yourself.
Yeah.
Because you remember a time that separates when you used to be normal, in quotes.
Yeah.
And the time that pain now became a part of your life.
Yeah.
It means you are no longer the duo Jaguero that was playing football with your friends. That you can no longer do it. And you can even remember, you can even place yourself at Karura and remember that on this particular day, something happened to me.
Yeah.
A cord was pulled in my existence and it changed everything.
Yeah.
It's the same thing I remember vividly. I was having a story outside Gandhi Wing, outside Taifa or at University of Nairobi.
Yeah.
I remember that very clearly because it separates the time when I was Omondi Ochuka, first year, and the time that I was now a cancer survivor, because the moment you're diagnosed with cancer, you become a cancer survivor.
Yeah.
So back to my experiences with doctors, there is one thing that has always bothered me.
Yeah.
I always call it the textbook way of approach.
Yeah.
Because most doctors are very textbook.
Yeah.
Because if I present myself with these symptoms, they already click. And I was also having this discussion with a friend who is a doctor, a psychiatrist.
Yeah.
And I was telling her that I have a problem when, and it's very common, especially even in America, and it's a crisis, even in the UK and in Europe, when somebody is likely to be depressed, they have mental health challenges, and they present themselves to a doctor. And the doctor reviews them. Most doctors tend to rush to prescribe antidepressants for this person.
Yeah.
When ideally, antidepressants may not be able to solve this person's problem. Like, if I don't have a job and the economic situations in the country, you know how dilapidated it is. If you give me antidepressants, and we know how the symptoms, the side effects that come with such drugs, this drug might not help me. I might probably need to travel home and look outside the window and see how life is happening for other people and realize it's not just me alone in this. There are other people in this situation, and I can beat this. I didn't need antidepressant to get to that point.
You needed just a chart.
Just a chart. Exactly. So when you rush to give me antidepressants, which I will be able to, at some point, if we don't manage it very well, I'll be able to I'll get hooked to it. I'll be dependent on it. It means I cannot see myself sustainably outside of those antidepressants. So I think most doctors, especially ones that are are too closed up. And the reason why is most of healthcare is not patient-centered.
Yeah.
I feel, and when we were talking last time off the camera, I told you that there is a lot of resource that patients who are going through it, like what you're going through, only you know it.
Yeah.
It might be universal depending on what the doctor has studied and has through their work experience. But what you're going through is very unique. It has like a unique ID. This unique ID, it's Oduor Jagero's, it's Omondi Ochuka's. You can't replicate it to another person's. And so if a doctor does not listen to you creatively with an open mind, they might not be able to treat you or to be of benefit or utility towards your pain or your kind of a problem. Most doctors tend to just limit themselves within that box of, hey, I went to med school, I'm the doctor here.
Yeah.
In fact, when I was diagnosed, I could do that. I could listen to a doctor tell me this. But lately, after 2015 and 16, especially after going to India and having to see the panel doctors, when doctors come, it's not just one doctor. It's a nurse there. There's a dietitian there. There's a neurologist there. There's a psychiatrist there. All these people with specialized fields and areas of expertise, and they are attending to one person who is going through maybe just one disease. Yeah. But we realize that a disease, especially pain is very abstract, and therefore it is able to permeate other areas, almost other areas of your life. Yeah. When you have pain, you can't work very well. When you have pain, you can't have sex with your wife. Yeah. you can't. You can't. When you have pain, you can't think very well. You are like decluttered all over the place. Yeah. So you need specialized areas of expertise to look at this pain and attend to it. Yeah. And if a doctor cannot be able to think outside of the box for you, they won't help you.
So, my experience with the doctor is that it's a bank teller. Yeah. Okay? Yeah. You come, I check. Yeah. Do you have money in your account? You want so much money to be withdrawn? Yeah. I withdraw it and off you go. Yeah. And I wish you a good day. and that has been, because I feel like in my life I have several boxes that are currently checked or unchecked. You see? Yeah. And they need checking, they need unchecking. Is it a nerve issue? Is it checked or unchecked?
And why?
Yeah. Yeah. Do I have a bone problem? Yeah. Is it checked? Is it unchecked?
You see? How was the checking done?
Yes. Yeah. You see, what is wrong with my plantar? And what is really wrong with my fascia? Yeah. You know, what is going on down there? Do I know? Have I been told in black and white that this is what is going on? I have never been told. Yeah. You see, so the last time I went to the hospital, I told this doctor that I need a panel. I need all these guys. I have an insurance for which I pay 100,000 per year. Yeah. Surely.
I should deserve this.
And then I was telling these guys that, you know, for example, the kind of problem that and these doctors, they hate when you tell them that you have read from the internet.
They're very dismissive.
Yeah. Yeah. And I feel like the internet is really what is the word? The internet is
it's resourceful, it's insightful.
No, I mean what the internet does to them. The internet exposes them.
Yeah, for their fraud.
In a very dramatic way. Yeah. You see? So you are telling me this, and then I go to the internet and I see, I read, you know, 6 pages, and they do not support you. And most of these, and I'm a blogger, I know, that some of the blogs that we read are actually written by doctors. Right. You know,
we read peer-reviewed by doctors.
Peer-reviewed by doctors. Yeah. So you can't say that I'm just reading from
some gutter phrase.
Yeah, I'm not. A lie has not written it. Yeah. You know, and I'm not being dismissive of a lie. I'm just saying that a lie is not a doctor. Yes. It's not been written by a lie. Yeah. It's not being written by Eric Omondi. Yes. It's been written by a professional doctor, and they are saying that, you know, this needs to be done. This needs to be done. So the problem now comes because now this doctor needs to do a series of tests. Yeah. And this is where I also sympathize with the Kenyan doctors. that you need to do 4 MRIs. The last time I did MRIs, it costed me around 68,000.
Yeah.
Remember, my outpatient is 90,000.
It's already exhausted.
So it's already exhausted.
Yeah.
You see?
Yeah.
So my problem cannot be catered for
With an outpatient
with outpatient, cover.
Yeah.
So I asked this doctor that, what needs to happen is that you need to admit me.
Yeah.
But now that is the problem with the Kenyan health system.
Yes.
That they only admit people who are dying.
Yeah.
Somebody who is going direct to emergency.
Yes.
That is the person that, according to Kenyan insurance, health insurance, should be admitted.
Yes.
If you're walking and you're explaining yourself, you don't need to be admitted. And that is very, very problematic because my case I need to be admitted for 3 days.
For monitoring and evaluation.
All these tests to be done.
Yes.
These people, like you said, a panel of doctors, each and every one is going to come and look at your problem and go away. The other one will come and look at your problem, even for a week. You're just being in there,
And then they review it together.
Yes. And they put you in
and you have to be there when they review it.
I work for clients.
Yeah.
And I can
briefs.
and I can go to a client's office and the marketer will be there. The designer will be there. There will be a team, 6 people looking at their problem. So why is it different in health?
When it comes to healthcare.
Yeah.
Yes.
Why can't doctors come there and talk to you and say, okay, we are all there and we are talking to you? It's not too much to ask.
It is not.
Because in any case, everybody is being paid to appear there and answer those questions or explain those circumstances.
Yeah.
So that is basically my biggest problem with Kenyan healthcare.
Yeah.
And the gentleman that when I went to Italy, the gentleman that did a minor operation on my foot, he was relying a lot on the MRI that I had taken here.
Oh yeah.
He had no time really because I was just there for 3 days.
To rescan.
Yeah.
Yeah.
He had no time to do anything. He had no time to call He told me these things should be done in your country. You have doctors there. They are supposed to sit down and figure these out. And even when I'm because right now I am just basing my whatever I'm trying to do with the scans that I'm coming with from Kenya.
Yeah.
You see. So anyway, we were talking about pain.
Yes.
So and then you are saying how pain has affected. Pain has affected me so much.
Yeah.
I can't do the things that I used to. I wanted to do. I have always dreamed of traveling.
Yeah.
I have traveled a lot.
Yeah.
And you have seen me in different countries.
Yeah.
But do you know what?
Yeah.
In some of those countries, when I came back from visiting maybe one of the best places to see, I would come back to the hotel and I would cry because my foot
it's not yours.
It's not mine.
Yeah.
It is in serious pain. And sometimes I would not get medication because you can't just present yourself in Europe and be given medication.
Yes.
So that is I wanted to travel. I don't know if I can travel, but very minimally. I've always wanted to go up to Mount Kenya. That dream has died.
I love hiking, but I can't do it anymore.
You see?
Yes.
I wanted. Do you know I stopped being photographer because of that?
Because of the luggage and the gear.
Yeah. I can't go to a conference and shoot for 5 hours.
And you stand the whole time. You can't do
can't.
That.
So that part of my life is gone.
Yes.
So and then the other problem that I've had with pain is that I don't know whether it happens to you. Every time I see somebody doing an activity that I like, is that psychological pain?
It is. It's psychological.
Yeah.
And there's one thing you said about how pain manifests. Pain has personalities.
Yeah.
Pain is like a day. A day has shades of personalities.
Yeah.
Could be raining cats and dogs in Nairobi, but in Nyakach.
Yeah.
It's sunny and beautiful. So pain has personalities, and it depends on which side of the bed it wakes up with you on it. There are days it pushes you to be very creative, and there are days you're so lethargic, you're so tired. It's the days you can be so grumpy. The days you see somebody doing something that you love, and you see the opportunity, the cost, it has robbed you of.
Yeah.
Because you wish you were in that place to be able to do something that you love so much.
Yeah.
And it's funny. It's funny because people say pain is pain. It's the politically correct thing to say in the new age era, where we want to be very careful with people. We want to be sensitive.
Yeah.
But pain is not pain. There are pains, and there are pains that are pains. They're pain than others.
Yeah.
That is the truth. And we might be talking about how our pain has affected our lives here. But if you go out there, you find somebody with you feel like yours is like
I have
a better life.
I have experienced that.
Yeah.
I have met some people that, are in, like my friend. What is his name? I forget his name. He has sickle cell anemia.
Ah, yeah.
And that shit is painful.
It's painful.
And so sometimes he does so much, drug that they have to take him to the hospital to do what? There is a word they use when they want to wean you off the drug pains.
The detoxing. Or
yes.
Yeah.
So every now and again he has to go to the hospital to have a detox.
Because he's used to very high dosages.
Yes.
And when you get to that, it's very detrimental to your own health as well.
Yeah.
So they always say pain is a limiter, and people always want to tell you, dude, just get over it.
Yeah.
It's in your mind.
But you see, that's
But is it the truth, really?
Like sometimes somebody tells you, let's take a walk to Yaya.
Yeah.
And they realize you can't walk. And you see, the thing is, you are a healthy man.
Yeah, you look okay. You
look so much okay. You are in rubber shoes. You are laughing the loudest.
Yeah.
Why can't you walk the loudest?
It's true. Yeah.
So that is. I think in a and like I was telling you that sometimes the pain for my pain, I have to be very careful in taking medication. Because then it is, if your pain here on your hand and you're taking medication for it, you surely know that the pain that you're feeling is, you're not walking on your hands. But my pain, if you take medication, then you don't know what you're doing. You might be making it worse. And you don't know because you're on painkillers.
True.
So it's very, very tough.
The murky waters of painkillers, like I told you, we've shared a lot about it. And it's one of the reasons why I don't like painkillers. In fact, I rarely do take painkillers. Most of the time, I brave it, except when kikiumana, that I need to take a pill or two. So the pain is, first of all, let's just look at the global point of view. Right now, America is going through a crisis. There's a widespread abuse of fentanyl, oxycodone, and people are dying with it. And some are even arguing that this thing is like Chinese sponsored or something like that.
Yeah. Because
most of these, drugs are actually manufactured elsewhere, India, China, and all that.
Yeah.
And when you have a way of not confronting issues, which pain usually makes you do. It makes you reevaluate your life. It makes you re-examine your life. What can I do? What can I not do? But when you're not ready for that, it means you'll always be trying to numb that pain so that you can be in a better functional mode. But what you're doing with that is sometimes you create an underlying problem that could be even worse than the pain. When you have a pain, and you want to work because life does not offer you the luxury of just sitting around. You want to numb the pain and go jump on a matatu, go to work. But you've not understood. Like for your case, when you take pain meds, you are just numbing the feeling, but the pain is still there. So if the nerve endings and the muscles are still being sore and being blistered, it continues. It worsens.
Yeah.
For somebody else who might have a migraine or like just a backache, they might have a pain med, they pop it and it goes. But what about the pain that when you pop the pill, it doesn't go?
Yeah.
What are you doing to yourself?
Yeah.
You're creating another problem. And that problem is going to be, to deal with that problem is going to be a difficult feat. Understand? So painkillers are usually a very treacherous path, because once you get to it, there is the risk of addiction. There's the risk of tolerance, because there are people who will be like your friend who have been so caught and used to like high dosages of pain. Like me, I got to a point where I couldn't, like a regular paracetamol wouldn't do any shit for me. Yeah. Because you've gotten used. Sometimes I have to do an IV, and this is for cases like people with sickle cell anemia. When they have a crisis, when they have a pain crisis, they have to be admitted. Then they have to have an IV hooked on them. That is the only way, the only sure way to deal with their pain, because the pills no longer work and they're not effective. So what do you do with that? It's very tricky, because it's not very easy to know which pain med works for your case, because it's not one shoe fits all.
Yeah.
And that goes back to, I think, an issue we raised when we started this podcast about misdiagnosis.
Yeah.
It takes, in fact, most people get misdiagnosed. Remember when we were talking about how many people have died in the past, but we do not know actually what killed them?
Yeah, especially in the village.
Especially in the village. Because back then we didn't have diagnostic tools that could enable us to accurately diagnose a patient. So we could probably just round it off, depending on the symptoms that are presented.
Yeah.
It's the same with misdiagnosis. A lot of people get missed. I'm very sure, even in your case, you're hanging in the balance. You could probably be thinking that you have
plantar fasciitis, yes.
But it's not.
It's not.
What if it is not?
Yeah.
So one of the difficulties of the pain that you're dealing with is the what if question. What if these guys are wrong?
Yeah.
You know, what if it's another thing altogether? And then the other most difficult part is some people don't have any diagnosis all their lives.
Yeah.
It's like lupus. You know, lupus, and I always feel like it's also the same with cancer. Cancer is not just a disease. It's like a group of comorbidities, things that want to kill you.
Yeah.
It's the same thing with pain. It's a host. Yeah, it's a host of so many things that are coming together. They want to kill you. You can't say that pain is very specific. Although it might be specific to a part of your body, it doesn't just come alone. It comes with a host of other problems. And so you could be trapped between the blur of not knowing what exactly is wrong with you, what exactly is causing your problem. Do you imagine how difficult that is, living with that?
It's very hard.
It's very hard.
Yeah, so thank you very much, Mr. Ochuka.
Thank you.
It's always nice to chat with you about issues of health and the issues of pain. We have been in the
trenches, they say.
The trenches.
Yes.
And what does it? Well, maybe we could talk about this in the next podcast. I think in the next podcast we can find something to talk about in as far as health is concerned, and probably how to preserve yourself, because the doctors told you that you'd have died by now.
Yeah. I was supposed to be dead 4 years ago.
4 years ago.
Yeah, posthumously I'm leaving, I guess. Look at how sad that is.
Thank you, my friend. Always a pleasure.
Oh, my pleasure, man.
All right, thank you. Until another episode.
Bye.